So Shikha, see, we as a country, we are so diversified. Our problems are so diversified. The way we exist is also very different. We have people in metropolitans, then we have tier B, C, D cities going to the very corners of the country. However, stress probably is all pervasive. Uh, as complicated as one's lifestyle might be, more might be the stress. This is just an assumption again. Now there are few issues that I see here happening. One is the availability of mental health experts, which we all know is in massive dearth. If we look at the latest reports of how many therapists are required to how many patients, we know that we are in we are in a dearth of mental health experts. Within that also, whosoever are available, many times clients would come up and say that we skipped therapy for so many years because our previous experience was horrible. And how does a client, what homework can a client who's in trouble or who really wants to seek professional help do before deciding to step into a therapist room? Whom do they go to?
Right. So, on one hand, there is a paucity of mental health professionals in our country. On the other hand, we have all sorts of practitioners available, be it life coaches, counselors, psychologists, psychiatrists, and sometimes it's confusing as a client and a patient. So, counselors are the ones who have probably undergone postgraduate training and a certified course in a focused area. They are trained to handle one specific problem, which could be career counseling, which could be addiction, substance use. On the other hand, we have clinical psychologists who are trained to handle clinical disorders. If you're talking about depression, anxiety, a person should do a background check and understand if these are the areas that they want help with. If they have been diagnosed with depression, preferably go to a clinical psychologist. And we also have psychiatrists. Now, these are medical professionals who can prescribe medications to you for your disorder. Now, they are the ones who have done their MD, who have specialized in psychiatry. So, when you are planning to look for a therapist for yourself, again, therapist is an umbrella term. A therapist under therapist, a psychiatrist can also come if they have undergone a proper training. So in some kind of therapy. So when you are looking for a therapist for yourself, try and do a background check about what kind of patients they see, what are their area of specialty. If they have license, a clinical psychologist needs to have RCI license in our country, and and sometimes it's as you said that patients might have had bad experience. It's also about a good fit between a client and a therapist. Sometimes you do feel that the therapist will fit my need, the need that I have. If the things are not going fine in your therapy session, I would advise to have an open communication, open conversation with the therapist and discuss about it. Sometimes the good fit does not happen and probably that therapist is not meant for you. And you can always look for another therapist.